So, continuing our discussion of the innate immune response, again, it's non-specific. We're going to talk about inflammation. So, we always think that inflammation is a bad thing. And yes, getting out of control, it is. But normally, it is part of how we defend against infection with your immune system. So whenever tissues are damaged, and it doesn't matter the kind of reasoning, so that's why if you burn yourself or you have irritation or some sort of cut or infections, all of these can cause inflammation. Why do we consider inflammation not always a negative thing? So, first off, it can stop the spread. So, if it's caused by, we're talking about the immune system. So, if it's caused by infections of microbes, then we need it to stop the spread. So, if it can prevent the spread and keep it localized or in one area versus it going throughout the body, that's important. It can also help get rid of any cell debris. So all those neutrophils that are dying, if we're talking again infections, fighting against the pathogens, then it can help get rid of that debris because we want to clean up the mess. And it can also get rid of the pathogens. It's also a communication system. So the immune system is all about communication and asking for help. So, when inflammation occurs, the adaptive or specific immune system can be called to the area. So, if it is, again, we're talking about inflammation caused by microorganisms. So, if it's a specific microorganism, we can bring our adaptive immune system or your T lymphocytes and your B lymphocytes to the area so they can help fight against the infection. It also helps with repair. So, this is due to injury or damage. Well, after we get rid of, again, we're talking about inflammation with infection, even though it does occur with other things. So, we're going to set the stage for repair. If we're injured and damaged, then we're going to need to fix that damage. So, this is going to be kind of the scaffolding for that repair. So, acute inflammation, meaning it happened quickly. So, short and quick. There are four major signs to inflammation. I think everyone's had an infection somewhere and has these four signs that you're saying it's inflamed: redness, heat or warm to the touch. So the area is actually warmer than the rest of your surrounding skin that's not inflamed if it is skin. Swelling or edema. So it's going to be puffy. And it's also painful. So it hurts. So, first stage of inflammation is you're going to have pro inflammatory chemicals or inflammatory chemical release. So, these inflammatory chemicals are going to start the signs or kind of the reason why we see the signs of inflammation. These chemicals are going to cause vasodilation. So again, vasodilation is going from blood vessel like this with this diameter to a blood vessel that has an increased diameter. Why does the vasodilation occur? Well, we want to increase blood flow to the area. If we're going to have white blood cells and phagocytes and T lymphocytes, B lymphocytes come to the area, well, increasing blood flow is going to help them get there. We also do what we call increased vascular permeability, meaning we make the vessels, specifically, it's going to be capillaries, leaky. So this is going to allow more kind of movement of our white blood cells. Again, they want to get into the area, into this tissue to help fight off the infection. Because again, we're talking about inflammation having to do with infection. So you want to actually increase vascular permeability. This is also going to bring along things that are going to help with repair as well. So you make it more leaky, easier for the red blood cells to get there and then get out of the vasculature and into the damaged tissue. So phagocyte mobilization, all those white blood cells that we've discussed that eat things or phagocytize, then they're going to um, come to the area. So they're going to be called to the area. So they will mobilize, get ready, and go into the fight. So one of the reasons why we see some of the signs of inflammation is because of those inflammatory chemicals causing vasodilation and increased vascular permeability. Vasodilation increases blood flow, which means there's more blood in the area. So if you have a larger diameter of capillaries, you're going to have more blood to that area. Well, blood has hemoglobin. Remember, the heme pigment is going to be red. So more hemoglobin and more red pigment of the heme leads to redness. We also have a lot of heat or warmth that's going to be in your blood. Remember, your blood's a little bit of slightly higher temperature than the rest of your body. So with it, when you're increasing blood flow, you're actually increasing the heat to the area. So this, when we looked at the acute signs of inflammation, where we talked about redness and heat, that is because of vasodilation. The increased capillary permeability, it allows more fluid to leave the blood vessels or leave the capillaries and go into the tissues. So again, permeability is allowing movement. So if we're increasing kind of the fluid that's leaving the capillaries, that means more is going into the tissues. So it's going into more of the interstitial space or the space around the cells of the tissue. Well, more fluid leaving the capillaries and not being drained out is going to cause the swelling, also known, fancy term, of edema. So increased fluid to the tissues is swelling. The swelling, so the increased fluid that's in the tissues and surrounding the cell in the interstitial space, is going to push on more of the nerve endings that we have in the area. That's going to stimulate these nerves, specifically nociceptive receptors, is going to cause pain. So just the vasodilation is the redness and heat. The increased capillary permeability is the swelling and the pain of the symptoms that we, or the signs that we see of inflammation. So those chemicals, the inflammatory chemicals that's causing the vasodilation and the increased capillary permeability, are released into the extracellular fluid, that's what ESF means, by either intertissue cells or immune cells, or I'm going to say more often, it's going to be both. Once the immune cells come to the area, they're going to release more chemicals. The injured tissues start off and release inflammatory chemicals. Histamine is going to be our major inflammatory chemical that we're going to talk about. That's released by mast cells or basophils. But mast cells are automatically in the connective tissues. Basophils, remember, are circulating. So histamine immediately is going to cause the vasodilation and making capillaries leaky, and also attracting more white blood cells, or the ones that eat into the area. Some other ones that are released that do kind of do the same thing, but again, histamine is going to be our major one, is kinins, prostaglandins, complement, which we'll talk about a little later, and then leukotrienes. But all are causing the vasodilation, the leaky capillaries, and calling more help. So same kind of thing, just picture form. Dilation of blood vessels, increased blood flow, increased vascular permeability. If it's trauma that's causing it, we'll have clot formation. So if it's a cut that's causing it. But redness, all of these kind of things will attract phagocytes to the area. So especially neutrophils, the first line of defense, 60 to 70% in your bloodstream. Um, they are going to release more chemical messengers that's going to kind of ask for help. But these neutrophils and the other phagocytic cells are going to clean up the mess and destroy any infectious cells if we have them. This is just looking at trauma wise, but you remove cell debris, the trauma, by neutrophils and macrophages, and they can actually stimulate fibroblasts. Now, remember, fibroblasts are the cell builders of connective tissue. So we're going to start repair. These also bring in our specific defenses, meaning our B cells or B lymphocytes and our T cells. So you remove the infection, you get rid of the clot if there is trauma and needs a clot, and then you have scar tissue, which is made by the fibroblasts.